Healthcare reform is not part of the problem when it comes to our fiscal future. It's a fundamental part of the solution. Real reform will mean reductions in our long-term budget. And I've made a firm commitment that healthcare reform will not add to the federal deficit over the next decade. To keep that commitment, my administration has already identified how to pay for the historic $635 billion down payment on reform detailed in our budget. This includes over $300 billion that we will save through changes like reducing Medicare overpayments to private insurers and rooting out waste in Medicare and Medicaid. However, any honest accounting must prepare for the fact that healthcare reform will require additional costs in the short term in order to reduce spending in the long term. So today, I'm announcing an additional $313 billion in savings that will rein in unnecessary spending and increase efficiency and the quality of care. Savings that will ensure that we have nearly $950 billion set aside to offset the costs of healthcare reform over the next 10 years. These savings will come from common sense changes. For example, if more Americans are insured, we can cut payments that help hospitals treat patients without health insurance. If the drug makers pay their fair share, we can cut government spending on prescription drugs. And if doctors have incentives to provide the best care instead of more care, we can help Americans avoid the unnecessary hospital stays, treatments, and tests that drive up costs.